Governor Reynolds has just wrapped up her weekly COVID-19 response briefing, and during that press conference, she reflected on how far our state has come in our response to the pandemic. Our political director, Dave Price, was at that briefing and joins us live this afternoon with more. Hi, Dave.
Jody, the governor today was asked about something that people have been talking about a lot. When can everyone who wants a COVID-19 vaccine actually get one? It was late Thursday evening when the State Department of Public Health announced that starting Monday, 2 days ago, things would change quite a bit. So the state would open up eligibility to everyone under the age of 65 who had some kind of chronic condition. And as you start working through that list from the CDC, you will find that most Iowa adults would find themselves on this list. They are conditions involving your weight, whether you smoke, whether you have some very serious conditions with heart and lungs or cancer. When it's all added up, it's far more than half of the adult population in Iowa that is now eligible to get one of these COVID-19 vaccines if you can find an available appointment. So the governor addressed when it would be time for everyone to be eligible.
As vaccine production continues to ramp up and the White House projects weekly vaccine allocations to increase in the immediate weeks ahead, we've been able to further expand eligibility to include individuals aged 16 to 64 with pre-existing health conditions that could put them at risk for more serious illness from COVID-19. Expanding eligibility was also necessary because a number of the counties were nearly done vaccinating other eligible groups in their area. And as I've said before, we need to do everything that we can to keep this vaccine moving. Nothing should unnecessarily hold up the process. So when counties are ready to move to the next eligibility tier, we must enable them to do so.
So no specific timeline really from the governor. A lot of this, it sounds like, after talking with staff after the news conference today, will come down to what happens with the Johnson & Johnson supply. So the president's announcement today was specifically about this Johnson & Johnson Merck partnership to purchase another 100 million doses of this, but this will take a little bit of time. So it sounds like they're really looking at the month of April in this state. That's when they are hopeful that the vaccine supply could significantly increase. They could not give us a specific amount of how much per week it would take before they felt comfortable to allowing everyone who wants to get a vaccine to be able to try to get an appointment. So for Johnson & Johnson, just for an example here, last week they received nearly 26,000 doses, but none this week because of the way the supply works here. Next week they might get about 4,000 or so, but they would need quite a bit more than that to significantly increase the state's weekly supply. So look to the month of April, it sounds like, for that potential for then everyone who wants to get a vaccine could be eligible to try to get one of these appointments, Jody.
That's a bit of good news this afternoon. Thanks so much, Dave, for that report.